Good evening, everyone. My name is Tamya Cox-Touré, and I'm here to moderate for the Black Women's Voices Let's Talk About Healthcare panel. I'm really excited to be here. This is an opportunity for Black women in Oklahoma City that are experts in this field to really talk about the things that they are experiencing, that they are seeing, that they are practicing as the experts here in Oklahoma City. The Black Women's Voices started in Oklahoma City is a monthly series that creates a safe space for Black women to share their lived experiences into action and self-reflection. We want to feel empowered. We want to be seen. We want to make sure that we're at the table when policy and decisions are being made. Unfortunately, there has been a history and continues to be a history of Black women being forgotten or left out. So this is a time and an opportunity to ensure that Black voices and women's voices are being heard. I do want to say that this is also an interactive panel. So if you are interested or you do have a question or you want more information from one of our amazing experts, please put in your chat, and your question, and we will do our best to get to it. This is an opportunity, again, for us as experts to really interact with our community. So with that said, I do first want to start off by thanking our amazing sponsors of tonight's panel. Our title sponsor is Blue Cross and Blue Shields of Oklahoma. We also have the Gooden Group and Bumper Shoots PR. Thank you again so much for sponsoring this event. So I'm going to stop talking, and I really want to get to our experts. My background and my work is really in policy, in healthcare policy, specifically sexual and reproductive healthcare. And what I've learned through my 13 plus years as a lobbyist and working in policy is that our issues as Black women are typically not at the forefront. So what I really hope that we get out of today is an opportunity to learn, share, to grow, and specifically to educate others about the healthcare needs that we have in Oklahoma City. So again, we have the experts here. If you have any questions, put that and feel free to either put it in the Facebook, if you're watching on Facebook, to put it in the chat, or if you're on Twitter, to tweet at us. So like I said, let's get started. So the very first question that I have for our esteemed panelists who will introduce themselves, and it really is somewhat simple, but probably not, but how does race and healthcare intersect? So the first question is, how does race and healthcare intersect? So I'm gonna start with Dr. Tabatha, if you don't mind introducing yourself, and then when you get a chance, answering the question.
Sure, that's a great question. And thank you to Black Women Voices for putting this great panel together. But my name is Dr. Tabatha Carr, also known as Good Girl Chocolate. Good Girl Chocolate is an Oklahoma-owned, female-founded, plant-based chocolate company. But as a naturopathic doctor, I specialize in women's health, specifically women's hormonal health, how hormones correlate to blood sugar problems, and we see that in the Black community, how it correlates to a lack of energy, how it correlates to hormones, how it correlates to stress, how it correlates to blood pressure, all these things that we deal with in the Black community. What really drives me is when I was 16 years old, I was put on my first blood pressure pill, and because there wasn't anyone there to intervene on my behalf to figure out why a 16-year-old was being put on blood pressure pills, by the time I was 30, I was on 3 different blood pressure pills. And the third blood pressure pill was to protect me from my first blood pressure pill. I've since lost almost 100 pounds since then and have come off of the blood pressure pills. But my mission is really to educate women on what is the root cause of what's really going on in the body. So I'm passionate about natural health. And when I think about how race and how that correlates to natural health and what I do, when we turn on the TV now, all we see is coronavirus, wear your mask, social distance. People with underlying health conditions are at greater risk. But what I don't hear a lot about is building your immune system. How do we build a stronger immune system? What's causing our immune system to decline? These are some of the things we're not hearing, we're not talking about. We're not talking about deficiencies in vitamin D and deficiencies in other very important vitamins and micronutrients that we really need to live a better life. You know, there's so much to that question. I truly believe that stress is really the root cause to what's going on, you know, what's going on in our bodies, because you can take stress, and stress directly correlates to inflammation. It's stress that's leading to blood pressure problems in the Black community. It's stress that's leading to high blood sugar. And when you think about that, this is all rooted in racism. You know, something my parents told me when I was growing up as a teenager. They said, you have to be better than them. And I didn't quite understand that. I didn't quite understand that growing up. And this had nothing to do with character. This had nothing to do with you're a better person, you know, than a white person. This was about if you have the same level of education as someone white, they will still most likely make more money than you. So this is what this was about. And because of that, we have to be better. We have to work 10 times harder to get paid, to get bank loans, to get mortgages. You know, we're working harder and we're getting paid less. And all of this is causing what? Stress. So I believe a lot of our health problems is definitely rooted in stress. And it's a conversation that we need to have. We definitely need to be educated on how we balance stress more as a Black community.
Thank you, Dr. Tabatha. Please introduce yourself, Basheera, and tell us about yourself, and tell us how race and health intersect.
Okay, first of all, I would love to say thank you all so much for inviting me to be a part of this amazing panel with these beautiful, brilliant Black women. So when I was asked to do this, I was like, okay, well, I'm fitness industry, that's healthcare, but you know, let's see, okay, how do we use my experience and my perspective on this to provide a different insight on the topic. So I'm answering the question how race intersects with health, but also within my industry, because it's similar somewhat to Dr. Tabatha's, but it's also a little bit different as well. So in doing that, I want to point out that also my focus for most of my career has been on coaching and educating in areas of fitness and nutrition, but I've also been a part of many community health programs in Los Angeles, Atlanta, Oklahoma City, and some policy. So I'm in the middle, but on both sides as well. It's very important to me. So do you all remember the Healthy People 2020 report? Even though it's 2020 now, people try to hush it up because they didn't get the numbers they needed. But do you all remember the Healthy People 2020? Well, forgive me ahead of time, I'm a little sarcastic. But the Healthy People 2020, which is now being pushed to Healthy People 2030, which is amazing. Initially, within that report, and I'm actually going to refer to it and quote in a little bit, Healthy People 2020 defines a health disparity as a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. Now, historically, what we've done as a nation, as communities, as states, is we've come together to try to fight the causes of illness and disease and other healthcare issues, but directly addressing the illness and the disease. Even when we talk about preventative healthcare, what is that? That's testing, that's screening. But what we have to make sure that we equally take note of is the absence of disease and illness does not equate with the presence of good health. And that's what we forget. We think that if people are not pushing over the borderlines, they're fine. And I'm sure Dr. Jihan could attest to maybe some of her peers. They feel like if someone's not in the danger zone, there's no issues. Well, in my field, and I would have to say I'm very textbook preventionist, very textbook. I believe in addressing lifestyle behaviors that then lead to risk factors that then cause many of the illnesses that Dr. Tabatha spoke about earlier, and many others will while we're here. There's certain risk factors that were caused by the way that we live our lifestyles. Now, not all of this is our fault. A lot of the health disparities do come rooted in racism and also rooted in lack of socioeconomic access, period. When part of the Healthy People 2020 had to deal with eliminating health disparities as much as possible, right? Well, 3 of the top social determinants that they brought up were, number 1, do people have access to healthy food? So say you're trying to do everything right, but you live in a food desert. The closest store to you, and this is happening in our Northeast community right now, so it's not like we're pulling this out of thin air. If you don't have access to transportation, even if a store is a little closer, you can't drive there. If you're elderly, you can't even catch public transportation because the buses and things don't have the routes that stop at a certain time where you can still go. So we have to keep in mind that it's not only race. It is very important that we look at race, but it's also the way the minorities and lower class people or people with less income are put into positions where they don't have the access. So I really look forward to also listening to some of the public health policy that could be going on in Oklahoma City. So Chantel, that was to you. I look forward to hearing how you're going to educate us about what our policymakers are doing very soon. But that's pretty much me in a nutshell. Very happy to be here and to continue to discuss this with the panel and also our live viewers.
Yep. So I think we're going to pump that to Chantel. Tell us a little bit about it from the policy part.
I appreciate that intro. That's awesome.
Yeah.
Thank you all for having me. My name is Chantel Hartman. I currently work at the state level with tobacco control. My background, I'm born and raised in Montgomery, Alabama. Ended up in Oklahoma about 6 months after grad school. But my background includes things such as men's health, veterans health, health equity, and like I said, now tobacco control has become my passion. And I'll use that as a segue to really talk about. We know public health is everything that we do, from the art to the science of trying to prevent death, disability, injury, and just overall disease, right? But when we hear about it, we say, okay, what does that mean? That's literally where you live, where you learn, where you work, where you play, where you pray. It doesn't matter. But from a bigger scale, especially as COVID has brought attention to public health, that's everything from the policies that you put forth when you vote for elected officials to the systems that you encounter, whether that's, as she mentioned, your transportation system, your hospital system when it comes to you going to try to receive any kind of medical care, all the way down to the environments that you may or may not have a choice to actually be on. So again, when you talk about some of those obstacles that we face as Black people every day, it goes not only with racism, but how racism has led to poverty, how racism has led to limited access to quality care. If we want to talk about gentrification and what that means when you have stable, affordable housing, and then you have an influx of people who come in and don't necessarily understand your community, but see it as a capitalistic opportunity, right? And they move away from what we see as culture and how important our neighborhood is to what we see as culture. Public health goes into health literacy. We talk all the time about, be able to look on the back of a food label and see how much sodium is there, right? But is that truly representative and beneficial to someone who may only have a 4th or 5th grade reading level? Is that what we want to focus on? So even when we talk about how we as a people have our own cultural and linguistic factors that we hold dear to us, are the people who are working in our community keen to those things, and do they even care? So a lot of times when we say public health, we say, yes, the data, the policies, but really it even goes down to the people that we are allowing to care for us. One of the things that I can say that has brought me to public health from a full circle moment is I remember growing up and hearing my mother say, I can't afford to get sick, right? And my mother worked for a federal agency. I grew up with a dad who worked for the state and had insurance all my life, but that was something that I heard from people. I can't afford to get sick. So as an adult, I asked, what does that mean? what can I do about it? What does that mean? When we as people won't even consider ourselves as the working poor because we can't afford to be sick, and holding the people in decision-making processes accountable for not their intent, but their impact. So standing up for what we really want as a people, but making sure that we know what influences how we live, your policies, your systems, and your environment. So I look forward to going a little deeper into what all that means. COVID has put public health on the map. A lot of times people don't think about public health because that's the goal, right? As long as we are doing what we need to do, you should never know we exist. So now the kind of cracks in our infrastructure are really being put into place. But I love seeing a panel of my sisters and making change and educating our people and really pushing the needle forward. So I look forward to talking a little more about what that means. Thank you.
Thank you, Chantel. Appreciate that. No I love the fact that this panel is made of experts from different areas, but ultimately we all have one goal, is to have better health outcomes for Black women and Black families. So Maggie, Maggie Green, will you mind telling us a little bit about yourself? And what I really like is that Maggie is a licensed clinical social worker, right? And that, so we're talking about healthcare, but we're talking about healthcare. So
yes, thank you, Black Women Voices, for recommending me to be on this panel. I think this is wonderful because I think with, for example, COVID going on, I think sometimes we really don't talk about a big elephant in the room, which African Americans deal with, which is mental health. And so that's where I come in on this panel. My background is in medical social work and in public health social work, and also being a licensed clinician, licensed clinical social worker. I also have certifications in maternal and child health, grief work, and also certified financial social worker. So I come with a lot of aspects of certification in dealing and working with individuals from a social work level. A lot of my level is done from a micro level. You know, I know we have a lot of sisters on here that work from a macro level, but I'm that one-on-one, you and me, going back and forth as far as understanding what it takes to be successful at a good place from a mental health standpoint. What I really focus on and hone on these days is maternal mental health. And with the focus of African-American maternal mental health and saving our African-American infant babies. I know it's really been in the media today in regarding maternal mortality, and understanding that component and how that impacts us from a health aspect, and also in dealing with African-American babies who don't make it to past the age of one, their birthday, basically their 1 year birthday. So with that, there are a lot of macro things that I need to understand from the policy standpoint, understand what are we currently looking at that impacts my population that I currently serve, which are, excuse me, maternal and child health, but with the emphasis today on African-American women. So I have to understand things such as social determinants of health. Of course, I need to know that. I'm a social worker. So I want to understand what are we looking at from a social aspect in dealing with compared to your non-white Hispanics and whites. And excuse me. And what that looks at is I have to understand different theories associated to that. For example, what I've become more aware of these last few years is the ACEs study, the Adverse Childhood Experience study, in approaching and dealing with African-American women. And what that talks about, that identifies is stress levels that a child experiences, how that impacts long-term outcome health. And so, which, for example, why it is increased cardiovascular disease among African-American women, poor mental health, depression among African-American women, other type of diseases, whether autoimmune diseases or cancer of that nature. So I have to understand those components in dealing with maternal and child health. I also have to understand, and what was identified before, as far as understanding food deserts. So for example, like redlining, I have to understand how important that is to the community and that I work with, dealing with these African-American women or families just in general, coming from different socioeconomic status. It makes a difference when you have a grocery store that is not 1.5 miles within your reach, as far as you being successful in making sure that you, as a woman who is pregnant or has children, being able to be successful in having healthy food. So in me assessing that type of stuff, I have to understand all these dynamics and how to approach women in mostly in what we're speaking of, African-American women, and how to best service them. I have to meet clients where they are. And with that, I think it's very important to make sure that, especially dealing with the African-American women, is that empowerment is really big with us and for us to be successful. But I can go on and on. I just wanted to touch a few things in what I deal with. Also, too, one thing before I quit speaking, I also deal with perinatal mood and anxiety disorders. So I deal with things like postpartum depression, postpartum anxiety. I see PTSD more in African-American women, pre-delivery or post-delivery, due to our experiences with structural racism, institutional racism. And so it's very interesting coming from a mental health aspect and how to approach them accordingly.
Thank you. I think that was I'll get into one of the things that I've seen as a theme of when we after our next expert. So Dr. Jihan Abdul-Haqq, as typical as Black women, right? She is at work, right? Work does not stop, so she is at work. But we appreciate you joining us in the midst of all that. So yeah, so if you don't mind just telling us a little bit about your background and expertise and how healthcare and race intersect.
Yes, thank you very much. So I'm Dr. Jihan Abdul-Haqq. I'm filling in for one of the other featured doctors who had an emergency. So I appreciate you all inviting me to this space to share. Many of the beautiful panels already touched on a lot of what I probably would have already talked about. I am a pediatrician by training, but I do see patients up to 22, some 23-year-olds seem to get in here as well. And I have a lot of focus on, I like to treat everything. You know, I'm one of those pediatricians. I love every age group, but I do a lot of work with maternal breastfeeding. And I also do a lot of work even with my teenagers. For a while, I used to have a lot of teen moms who came in and did things to try to foster that. So in terms of, and I'm the owner of Peace of Mind Pediatrics in Del City, Oklahoma. And so that's actually where I am right now. Just finishing up. I'm not working right now. I finished up, but I didn't get a chance to get home yet. So in terms of in my line of work, how does race and health intersect? And it's huge. Obviously, I'm a physician, right? And people are always talking about, you know, health disparities and things. One of the biggest things that I see is that there's implicit bias. If you've heard me speak recently, anything, I'm always talking about implicit bias, right? But it's really important because what I'm often seeing is that there's so few African Americans within the healthcare system. There's even fewer African American women. We make up about 2% of physicians. African American women make up about 2%. But we have tons of studies showing that people who are cared for by like African Americans who are cared for by African American physicians have better outcomes. But we can't seem to actually get our people to this level. And so one of my missions, I actually have a mentee right now, is really getting that next generation to become physicians, to become health practitioners, so that we can actually be caring for each other. That's not to say our other colleagues do not care for us or have that respect. It's just very different. And that's when we talk about the implicit bias, is that in your mind, if you grew up in an area where there were no African Americans, none of your friends, anyone you associated with, when you have this person come in your room, you just may not relate as well to them. I have people come to me all the time and talk about their kid doesn't want to eat. Well, I see every race, religion, you name it. I have also familiarized myself, though, with so many different races, religion, ethnicities, cultures. So when my Vietnamese family comes in and says their son won't eat vegetables, I immediately can say, do you eat pho? Okay, you eat pho. Well, can we cut up some basil and because I know what you eat. Would you eat a spring roll? So okay, so you're Latino. Well, this is how we're going to change your arroz con pollo. And then even my African families, okay, we're gonna change the, when we make egusi soup, we're gonna add a little bit of this to make it more healthy. So it's really about understanding the culture. So I do a lot of education in terms of nutrition, obviously, as a pediatrician, and making sure that I try to relate, what do you eat? That's often what my question is to people. What do you actually eat in your house? And then I can talk to you to see how I can navigate it, but still being within your culture. Because if I tell you to eat what I eat, it will fail every time, because we're not going to eat the same things. I was raised differently than you were. I didn't grow up in a house eating soul food. I don't even cook. I don't even know how to cook it. Okay. You don't want me to cook it because I don't know how to cook it, and so that is where I often can meet people. But I think that it's important that as health practitioners, we are teaching those, and also especially the medical students and those coming behind us, to interact more and to get to know families on a more personal level, and to know more people and even their peers. If you look at our medical school, you may have 4 Black medical students. I don't know the statistics. I know if I had gone, I didn't attend, but there would have only been 2 of us. And so even in that sense, is the population that is often being cared for is more of a minority population, but many of these students have never really interacted with those populations. So it's very important that we start to put in place more courses and experiences so that more of our health practitioners get to know the communities that they actually serve, so that they see when grandma comes in and she didn't take her medication, they understand she didn't take her medication because maybe we talk about health literacy. She didn't understand, right? Also, was she able to get to the pharmacy? Mm-hmm. She may not have been able to get to the pharmacy. Did one of her children say, you don't need to take that, you're just fine, right? So it's understanding the culture and kind of why I'll never forget my attending in medical school. I went to Morehouse School of Medicine, and my attending, he yelled at me because I said someone was non-compliant. And he almost jumped over the table at me. He's a reverend, by the way, so he talks loud anyhow. And he said, how can you say someone's not compliant? Do you know their background? And then he made me think about those things that I just mentioned. So now I don't use the term non-compliance. I say, did I do my job so that you understood what I said? Because sometimes I speak fast and go from patient to patient to patient. Sometimes I may have to call parents later and go, did you actually understand all of that? But the other disparity is I have clients where they don't have what they need. So not only do you maybe not have the education, but you don't have a support network. So I'm asking you to do these things and you can't even get to the store, not because you don't have a car, but because you have 4 children and you can't leave them at home. So it's navigating these circles and making sure people have that community we once had. And that's where I see a lot of our issues. And we, at one point in time, the African-American community looked out for each other. Right? We knew our neighbors. We would help our neighbors. There should never be a single mother who doesn't have a support system. And there should never be a mother who is in a relationship that doesn't have a support system. We lost that tribal aspect with colonialism. We know it goes way beyond, but we really have to bring that back and learning how to support each other and come together. And so I think that as we teach practitioners to do that, and then we also are educating the community on the importance of that. I know today I literally had to tell somebody to have their cousin call me so that I can explain to the cousin why they need to help her. Mm-hmm. The cousin doesn't understand because unfortunately the mom is having some postpartum depression, right? Mm-hmm. So you have to tie in all these other things, and sometimes you end up at work a little bit later. And also a reminder of self-care, which I'm horrible at, but I think that it's very important.
We'll definitely get to self-care. No, I think that's really important.
But we learn from each other. Where I come into the picture in some of those things.
I did not expect within the first 30 minutes of this panel that I would hear colonialism, but I think it's so important. There has been such a trend with all these amazing experts And I hope the viewers have caught on to this trend. We talked about stress. I think everyone in some form or fashion talked about how stress is one of the biggest indicators of healthcare outcomes. But to talk about implicit bias, we had recently we had a piece of legislation that would have required implicit bias training for healthcare providers in birthing centers, specifically around Black maternal mortality rates and Black maternal health. And the backlash that this legislator received around it was astonishing. And I think it goes back to the education that we need to see. So with that said, and we're really talking about systemic issues that we can go to the experts, but if we're not facing it and we're not battling the systemic problems, are we really getting anywhere? So my next question really is, can we talk about ways that we can break up or break down those structural racial barriers that we see, whatever they maybe are, and how you see that we can break those down, in your field of work? So with that, I'm going to actually start with Basheera, if that's okay with you. If you don't mind.
Sorry there, I had to unmute myself. Yes, of course. And first, I'd like to say I am just loving what I'm hearing from my sisters. I am being educated. I am being brought back around to information I haven't heard for so long. But this is so important to where we are right now in our community, in our lives. And I think it's extremely important that we understand. Now, I know we were talking a little bit about the politics and things, that I have done some work with policy, but more overall community health. But I think it's extremely important that we as individuals and experts don't stay within these boxes or, within our windows and our fancy castles. And not saying that we do that, but we don't isolate ourselves, even though we are experts and, we have all these accolades, these resumes. We have to get back out in the communities, you all, because if those of us with the knowledge don't go out and start teaching others, it gets lost. And no, it shouldn't, because we have all these systems in place to continue to educate and to train and all these workshops. Anyone who's worked for any government system knows that is not fail-proof. Oh, has anybody been to a system of workshops from the government? I'm just saying. I've taught a few, so I hope those were okay. But I'm just saying it's really hard when you have that many workers in one organization or in one company and you're trying to come up with a singular objective. So sometimes it takes us going to the root of the problem and then not preaching. I love the way that I believe almost everyone has this flavor about them where it's understanding where the people are and meeting them there, not coming to them and preaching to them that they're wrong. Everyone thinks I'm going to make them drop and do 20. Eventually I'm going to do that. But at first I want to know, how do you feel? Are you comfortable? Were you stressed out? What are you eating? How can I help you eat better? How can I learn how can I help you understand why this food is best for you, or why we should start with our own gardens, or why we should pick our own herbs and spices, and why that's better for us, or why going back to the way we were taught from the motherland could end up being something that is not only wonderful for us physically, but you all spiritually coming back into alignment with who we are as human beings, and I travel a lot to Africa, so I'm not going to go way into that because I know my perspective is real different, but just helping people to align with who we are as a community and who we are as collective human beings, who you are. When we got here, we cared for each other. So why does that have to end? And so, yes, we need our politicians to get on board. Yes, we need other people, but you all, sometimes we can't wait for them to make a policy to make our lives better when we can start making our lives better in our homes right now. That's why I said I like to focus also on lifestyle behavioral change, because I believe you have power. I don't let anybody take away my power. I don't care what position you have, 45. You don't take away my power. Sorry.
Right. I knew at one point we were just going to go off the rails. Right? And this is what we do, and this is how we learn. So that is what this is about. So for our viewers, we will not be apologizing for being us. So just so you know. But I want to say, Gina Taylor just in a tweet that said, I am my sister's keeper, right? And there's no truer words than that, right? That I am my sister's keeper. Yeah. So important. So Maggie, if you can talk to us a little bit about, like, in your area, what are those structural racial barriers that you can see? And, and if there are, what are the solutions that we can help break them down?
What I realize in my line of work in dealing with, structural, racism, institutionalized racism and things of that nature is when I'm doing that one-on-one work, it's really hard to move mountains from me with you, one-on-one with the client. So when I talked about that, meet them where they are, I have to do what's best to make sure that they are their best advocate. Mm-hmm. And so that's something we got to do, things we can control. I can control making sure that a mom is organized. She has a book to write her appointments down that she goes to. She has her a journal to write down things associated to her infant. I can control that. I can control a mom being better budgetary wise, understand her finances associating to her and her family and her children. And what I also can control is her being an advocate going into the healthcare system. The louder you are, the more you ask questions, the more you will feel more in control of you being successful and coming out the end from not having any issues, maternal morbidity or mortality, and your infant hopefully being in the best situation that it can be. And so that's really my impact that I can do from that. And I also want to make sure from a mental health standpoint that you are empowered as an African-American woman or a white woman or a Latino, Latinx family in moving forward and meeting you where you are with your support system. I've sat down with families many of times on behalf and talk about this is, I think, educating them is so important to understanding what you're going into. I've told many African moms, I'm going to tell you how you may be treated going into being pregnant, delivery, postpartum time. I believe in laying that all out in front, and then how are we going to address it accordingly so you can be your best advocate? And that's how I really approach things associated in dealing with racism associated to the healthcare system. What can we control? Just like Basheera had mentioned in regarding that, what can we control in the house to what we're eating, in the home setting, and that's where I come from as far as making sure that that my clientele is successful.
Right. Advocating for yourself, super important. Dr. Jihan Abdul-Haqq, talk to us a little bit about, if you don't mind, in your area, how can we break down some of those structural barriers that we continue to see?
So I think the biggest way is similar, but I kind of approach it from two, the micro and the macro. So in terms of the micro, of course, controlling what you can, but we have cycles that have to be broken. So we have to figure out, how do we break these cycles? I just give an example, pretty small. Someone grows up inner city, doesn't have much money, doesn't have access to good healthy foods, goes to a school where it's not as advanced, okay, does their best, but can't get certain jobs because the school they went to, didn't give them that strong foundation they needed. Or say someone, gets pregnant at a young age, then has to work, can't go to college, etc. We have this continued cycle, right? And the question is, how did we break some of those cycles? So a lot of it does have to do with race, just because of where inner city, a lot of African Americans are in the inner cities. And even the people who move out often don't come and help within those cities. So if, say, a family buys that house in that neighborhood, that means you have generations of people going to the same school that didn't give them the proper education, which is going to prepare them for a job that will actually allow them to make more money, right? So then you have these cycles. So then you have the young mother who has the child, and then that child is still raised with those same things, the poor nutrition, the lack of education, and so it's kind of like, at what point are we able to make more money to where we're not working 2 and 3 jobs, increased stress? Well, guess what? I have to work all the time. So my kid has to attend daycare. I can't breastfeed because I can't pump at the job. So therefore my child doesn't get that I call it liquid gold, but I understand people who can't give liquid gold. But it's that cycle. So it's like, how do we break that cycle to where people aren't having to do all these things? And then you also have the cycle of, we do have to talk about incarcerations. African-American women here in Oklahoma are getting incarcerated. So you can't do anything, right? And so it's like children whose mothers are in jail, or their fathers are in jail. What does that cycle look like? She was talking about the ACEs. So we really have to put a lot of focus on how do we break some of these cycles and how do we approach them differently. When we talk about ACEs or the adverse childhood experiences, we also talk about resiliency. So what are the programs that we're helping to help these children and these families? There are people who offer food for free, nutritious meals to make sure that our brain development is going. There's early learning, early childhood programs. A lot of those were taken out, unfortunately. They were in some schools districts, taken out of others. And so it's bringing back some of those things. And the problem is the funding gets taken away. So I also work on the macro. So I'm talking to our legislators. I'm talking, how do we bring back some of this funding? Well, people didn't utilize the programs. People didn't utilize the programs because people didn't know about the programs, or people didn't understand the importance of the programs. So the question is, how do we get people to understand the importance of these programs so that they can therefore benefit from? There's a program in Family Expectations, and I apologize if I'm giving somebody credit, and True Dads. They're trying to keep families together, right? We have a system in which, people, unfortunately, women who receive TANF and receive support, when the father's brought in the home, then you got to pay more taxes. Then you lost the money for daycare. So it's like, well, hold on, I shouldn't get married, because if I get married, then I'm going to lose these benefits, and we barely make enough to get by anyhow. So we got a lot to work on in terms of breaking these cycles. And I didn't even touch on the mental health aspect, which we're also trying to get increased funding for as well.
No, great point. Great point. Dr. Tabatha, talk to us a little bit about in your areas of expertise, how are we breaking down those barriers, or how are we not breaking down those barriers? What should we be doing?
Sure. There's been a lot of goodness shared, and I'm listening to what everyone has shared. And, we talked about maternal mortality and how it's higher in Black women. We talked about stress and how it's higher, just not in Black women, but in Black men as well. High blood pressure. Who is it higher in? The Black community. Diabetes diagnosis. The Black community. Fibroids. Black women come to me all the time about fibroids. Who has Black fibroids? The Black woman. And we really have to start paying attention to why, why is this? And it just leads back to, what all the ladies were saying, bringing in, Basheera was talking about, diet and nutrition, talking about the food deserts, what's going on here locally in Oklahoma City. Oklahoma City is not the only community. There are thousands of communities that do not have access to good food, and when you don't have access to good food, we think about stress, but, a lack of nutrients is stress. Refined sugar, that's stress. So we have chemical stress, environmental stress. What's going on in the body? There's so much stress. I can even go all the way down to xenoestrogens, and that's what's leading to fibroids, ladies. When we talk about fibroids in the Black community, estrogen dominance is what I'm talking about. But when you talk about how do we break down these barriers, Dr. Jihan, she mentioned it. We need more Black doctors. We need our leaders listening to the Black doctors we have. I can take you back to my personal testimony of being, 16 years old on a blood pressure pill. That's ridiculous. I should not have been on a blood pressure pill at 16 years old. So, there's a lot we can do, but then it just ties back to education. It's what we're doing tonight. You know, I've read so many comments, you know, right here on this feed about how good this is and how thankful people are that we're on live talking about these issues in the Black community. And we need to continue doing this. People need to know, hey, there are other options. You know, there are better options when it comes to your health, when it comes to natural health and really healing your body. And I know Basheera can speak to this firsthand when it comes to nutrition and exercise. And Dr. Jihan, she spoke on it in pediatrics. It's so important. We need to continue educating people. Leadership needs to, and I'm talking top down, needs to listen to Black doctors and the Black community, and we need to continue to do forums and panels such as this so our people can get the type of education that they need.
Thank you so much. That was really helpful. And Chantel, I'm not leaving you out, but from policy person,
I'm enjoying myself. That's all right.
No. From policy person to policy person, I wanted to give you the opportunity to ask the first person to ask this question to.
Okay.
But I want to remind the viewers that we do want to take your questions. You have experts on here from fitness and wellness, pediatrics, neuropathic, licensed clinical social worker. So ask your questions. We know that there is not an opportunity to have all of this knowledge in one area all the time. So please don't forget, we want to make sure that we can get to your questions. So from a policy person to a policy person, we are steeped in Oklahoma with negative healthcare outcomes that happen to Black women specifically. And we know the statistics are vast. We know that despite the socioeconomic, wherever a Black woman is, low income or high income or no income, she is still having disparate Black maternal mortality rates, right? Like we're still seeing Black maternal health still lower, despite where a Black woman is on the economic status. But we also know that it's been through policy that we've seen some of the biggest avenues of access to health. The Affordable Care Act being one of the biggest ones. States expanding Medicaid. Oklahoma just expanded Medicaid last week. We had a Supreme Court, as timely as it is, we had a Supreme Court decision that came down today stating that universities and or employers can deny birth control to their employees through their health insurance, right? So some of the big avenues to healthcare have been through politics. So my question to you is, should politics stay out of healthcare?
Yes. The unfortunate answer, and it's like the background, right? So the thing that we say is public health is politics, because a lot of things that we have to take from our daily jobs to get them in place for the community has to go through someone in politics. So one of the examples that I give people all the time, I work in tobacco control. A lot of people see tobacco as this super old thing, like nobody smokes anymore. That's not a thing. That's not a thing. But it rained havoc on our community for years. So the example that I give everyone is this. If you remember when Jet, Ebony, and Essence were the hottest things for Black people to get there, whatever they needed, right? If you can just reach back in your memory and tell me the first 2 pages of those magazines likely included 2 major advertisements, and they were tobacco. And they were Newport, and they did the jazz festival, and they said they were cool, and they had the beautiful Black women with the afros, and it's a constant thing, right? Then they would come into our communities and do events and say they're sponsoring things, right? From a community, and that's from your entertainment, things that you engulf with your culture. But then if we take the next opportunity, how many of you can really think about your day-to-day when you go get gas and get groceries, how often you encounter tobacco in your communities every day? And it's you don't notice it. But the unfortunate part about tobacco is that it plays on the fact I have to get a replacement for the person I know that's going to die. I bring that up because one of the major reasons why Oklahoma can't address tobacco, even though it still ravages our state, is because of politics. you have legislative and policy language that's called preemption, which prevents local level authorities from being able to control what happens in their organizations and their local level because of things like preemption, right? Preemption is controlled at the state level. It's far easier for us to control things at the state level with policy than it is at the local level, because likely at the local level, your elected official is your neighbor, your deacon, your person that you see at the PTA meeting, whatever the case may be. So when we talk about things like policy, absolutely policy is public health because it addresses your day-to-day. So one of the things that I tell people all the time is that I look at the work of Dr. Renee Kennedy, and she's at the Michigan Public Health Institute. And one of the things that she says is people who work with policy need to be culturally competent, but humble. Those are two completely different things. So yes, you can think you're competent, but competent comes with like a credential in people's heads sometimes. But for you to be humble enough to go into someone's community and say, hey, I need to know what you need. I'm not trying to insert what I think you need. So one of the things that we have to address is how do we have people every day at the state level, at the national level, who are making these policies that impact dozens, hundreds, thousands of lives, and they can't connect or don't care to understand what the root causes of the issues they're making policies really are. So when you say things like, oh, this policy will help so-and-so, well, what's the root cause to it? Why do people smoke? That's irrelevant to me. What social conditions and economic conditions require and cause people to smoke? When we say, oh, we're going to improve their access to healthy foods, well, backtrack that. What policy do you have in place that's making it not so easy for people to, are you only running the buses from this time? The other thing is, isolating people who need social support services. Okay, great. But what institutional policies and practices do you have that maintain these barriers in their space? So a lot of times when we think about it, yes, you have people who are doing these jobs every day with credentials, but do they truly know what the real issues are from a cultural humility and competence standpoint? Not all the time. So when we push people to go out and vote, one of the things I tell people all the time, ask them hard questions. What do you believe led to these problems? What policy do you think sustains these issues in my community? That's going to get you a completely different answer than what policies do you plan to put in place. Because then you know whether or not they really understand what the root causes are and if they have people around them who can fix it. Public health is politics.
That's great. That's great. I'm going to actually move that to ask that same question to Dr. Jihan, because you immediately said no, and I feel that a little bit.
And I think where your work is and mine, and so one of my very close friends is Dr. Flajan Kofer in Sacramento, big time public health person who always is on me about stuff, right? Because I'm like, and she's like, and she's like fighting with the mayor and stuff. So yes, I agree. Public health is politics. Me as a physician, why I wish that politicians would stay out of health is because majority of the time they have no idea what's going on. If you look at our legislatures, we don't have any physicians in the legislature. So you're making decisions about people's lives and you literally have no clue what you're voting on. And so when I say staying out of it, policy on things, the structural things that she was talking about, yes, those are different. But it's like, how do we separate those types of things from you just saying, oh, abortions, we should just ban abortions. Whoa, are you going to take care of those kids? Like, how are you against abortion, but then you're not going to give them birth control and you're not going to take care of the kids? Like, you can't do that to people's lives. Literally saw a woman today who had a failed abortion who, just devastated because she really can't take care of these kids, and she's struggling to try to figure out how she can take care of these children. And we talk about pro-life, but I'm like, if you're pro-birth, right? There's a difference. You're pro-birth, but you're not actually looking at these children throughout their lives. So that's one aspect where I'm like, kind of come out. But they're often trying to punish us as physicians for doing things. And I have a problem with that, is that they've made it a very litigious society in which everybody wants to sue us for every little thing. But then you also have, like, politicians, to me, shouldn't necessarily dictate immunizations. I get that's public health. and some things need to be put in, but we need to be making educated. It shouldn't just be whatever group comes and lobbies the hardest, and then you make the decision. Like they almost overturned a complete thing this year with the immunizations, just because the people who don't want vaccine exemptions or want vaccine exemptions lobbied harder than the physicians. And you're often going to get people lobbying harder than us because we're taking care of patients. We don't have time to sit at the Capitol. And I have been up there to lobby, and I had to cancel patients to do that. And so I think that my frustration is when I was in Georgia, in Atlanta, they actually tried to pass a bill which would incriminate physicians for taking care of illegal immigrants. Mm-hmm. How do I know somebody's an illegal immigrant? People don't bring passports. I'm not questioning you on that. Like, how is this legal? So you're going to have a woman come to this country. She might be illegal. She might be pregnant. So now we're going to deny her care. So we're not going to take care of the child. We're just going to let the child die. Like, we're not going to do that. We take oaths to do no harm. So it's very frustrating when politicians come in and I'm like, we took an oath as a physician. I took an oath to do no harm to anyone, no matter their race, their gender, no matter what, no matter their status, their legal status in this country as well. So for me, it's like you have to figure out, we need, yes, Medicaid expansion, politics, yes, past that. But what if it failed? Because technically we were looking at Stick Care 2.0, which is still out there, I guess, Yep. But technically we declined Medicaid expansion. The politicians did. The people voted to keep it going. So it's a question of how do you make sure that decisions are actually made for the greater good and not based on our own biases and our own beliefs? Because my beliefs have nothing to do with your health and your well-being. I put whatever I believe to the back because it doesn't matter. It matters how we are making sure that every Oklahoman, every American is getting quality health care, whether it's mental health, public access to public health things, all those things, and physical access to health and wellness. How are we making sure that those things get done? And we don't do that. And the politicians, no offense to y'all. I mean, I talk to many of y'all, I love y'all, but if you don't have the background, then we really need to figure out how's the health committee really listening to, who are they listening to and who's advising them and who are they reaching out to? I do know that some of them have personally texted me about several items, and I often try to, give advice. And so I do appreciate that, but that shouldn't be how it works. There should actually be a group or a system who is non-biased and actually a representation of the community who is making sure that decisions and things are beneficial to everyone, not based on our own personal biases.
Woo! So that is why Black women need to be at the table, right? This panel is a good example of why representation matters. And so, Dr. Jen, like you, as a lobbyist for Planned Parenthood, you took me to another level with that, right? And I'm the moderator, so I have to step back. But that was tough. But thank you. But I think I ultimately think that's what the two sides that we're trying to figure out is that yes, everything is politics now, but really should they be? And I think you and Chantel definitely explored that. But I definitely want to open that up to other panelists if y'all want to take that on as well. So the question really is, should politics stay out of healthcare? If you don't want to follow that up, I understand that as well. So
I am a very smart woman. Go ahead, Dr. Tabatha.
Yeah, it's a no for me. I'm sorry, but whatever they put in a COVID vaccine, I'm not taking.
Mm-hmm.
No, I'll pass. So I believe that they should definitely, stay completely out. But what really just is disheartening, and Dr. Jihan really brought it out, is you want to cut Planned Parenthood, you want to cut WIC, welfare, all of these programs that provide aid for those that need support, yet you want to pass laws for no birth control. It's like, what sense does that make? I don't get it. I don't understand it. But I'm a no, just like the other ladies. I've never ever taken a flu shot. I don't plan on taking a flu shot. And I'm not for all of these immunizations. I'm not. And when it comes to the natural health world, you know, the government wants to place so many regulations on supplements and homeopathic, you know, supplements. You know, now the industry can't put on the bottle, you know, everything that vitamin D supports. Dr. Jihan, she knows in pediatrics, she knows exactly what vitamin D supports. But can we put it on the bottle? No, we can't. You know, we can't put things like what omega-3 fatty acids is good for. You know, there are so many regulations that's just, you know, keeping us from being educated, you know, in the natural health world, and it's really sad. And they're trying to pass bills all the time that affect things like homeopathics, which really help people. They help my clients. So it's a no for me.
Yeah. Maggie or Basheera, do you want to take that on?
Basheera, did you want to go? I have a double-edged sword because I am in the public health sector, and politics being involved can be very detrimental to the clients that I've served. Mm-hmm. Like, for example, well, I like to just use a term that I like to say myself. You know, policy gets impacted with someone like a politician is impacted. Then we get things, you know, put in order and we get things changed. So, and like Dr. Jihan was saying, you know, we have individuals who are unfortunately not competent to handle such bills and pass such laws and things. But like I said, things don't get passed unless it's been impacted by an individual policymaker. Like, for example, it's something that you wouldn't even imagine have recently been passed here in the last year or two. It has just been passed that women who are incarcerated during delivery do not have to be handcuffed. What are we talking about here? And what does that impact African American women? Because our numbers of incarceration are higher than we know of any of our other races or ethnicities. Mm-hmm. So that impacts Black women. And we also have things, you know, that are discriminatory in nature that we will not get appropriate reform for. And dealing in maternal mortality for African American women and dealing with infant mortality that we have. At the same time, the double-edged sword, Medicaid expansion is a hoorah for us. Mm-hmm. In dealing with women in pregnancy, there's two forms of type of Medicaid you can receive: soon to be sooner and regular sooner care. Mm-hmm. Soon to be sooner cuts off the next day after you have delivery. The next day after you have delivery. Then you have sooner care, which lasts up to about 6 weeks post-delivery. With that in mind, with me looking from a mental health standpoint, when I deal with things such as postpartum depression, postpartum anxiety, that does not kick in until about 3 to 4 months postpartum. Mm-hmm. So we have women running around here, which is about 1 in 5, 25%, whichever statistical number you want to use, that are walking around within 1 year of having their child, and they are dealing with postpartum depression, postpartum anxiety, and they are not able to get treated because they cannot afford it and do not have health care. Mm-hmm. Also, too, with the expansion as well, they are able to get appropriate women's care, mm-hmm. women's health care, mm-hmm. that we know that is lacking just in general with women's care. They're able to get that blood pressure from that preeclampsia that they received going during delivery or during pregnancy that they developed. A lot of women, when their sooner care is cut off, it is not managed. Mm-hmm. And as we know, as healthcare individuals, that links to long-term health outcomes, unfortunate health outcomes. And so when we have things like that, that is a win for us. We need that because I understand that mental health affects physical health, and physical health affects mental health.
Yep. Oh, great point. No, I think those are all great points. And I think that is one thing I love about This was Black Women Voices, and we are hearing on all sides, not even both sides, but all sides of these issues. So it's really, I'm really grateful for you all answering that. I am looking through our questions real quick. Before we get to our last question, I want to be very respectful of everyone's time. What I'm loving about some of these comments are people are in total agreement with us, right? That representation matters, that it doesn't make sense for politicians with no medical or healthcare background to be making decisions for ourselves. We even have some candidates that are running for office. They're showing up on our panel. And one thing I do want to say, I think it's important, is that we have elected officials watching right now, and one honestly just texted me. Senator Carrie Hicks just texted and said, "This panel is amazing. She wants to run an interim study on prenatal and postpartum care for Black women, and she wants our help." That is why we do this work, and that is why this panel and Black Women's Voices is so important, and why I'm happy that we can continue on. One question before I get to our last question and kind of closing remarks was from Betty Jean Harris, and she asked, should we write a Black women's healthcare bill of rights? And as a former ACLU lawyer, what all I did was defend the Bill of Rights. Hell yeah, we should, right? That is me, that comes from me. But right, should we talk about, and is there a problem when we really talk and really focus policy on Black women? I kind of think is kind of where Miss Betty's coming from. But more importantly, should we just continue these conversations? I really believe in disrupting the system, and I think I've done my whole career about how we can just like working within the system and trying to dismantle it. Maybe we don't need a Bill of Rights. Maybe we just need like community agreements from all of us. But I'd love to hear kind of y'all's thoughts on should we write a Black women's healthcare Bill of Rights? And I'll let anyone take it. Yeah, Basheera, go.
I'll jump in there quickly. And of course, I'm not coming from the advocacy, definitely standpoint. So mine is more so being an African-American woman and growing up and seeing us being underrepresented, many of the things that pertain to us. And that's one thing I think we have to be aware of in our communities as minorities in this country is you can't always expect other groups to speak out on what is important to you, even the most well-meaning, because they aren't you. They didn't grow up as you. They didn't grow up with your mothers, your fathers, your grandfathers, your grandmothers, your aunties, your uncles with the same collective issues many of us did culturally, even if we grew up in different places. So I think that's something that we should look into very seriously because these conversations are great. But unfortunately, a lot of the people who need to hear it, it takes time for them to tap in and learn how to use Zoom or to click on the link. Some of those things can stand in the way, even though people are well-meaning. So I would love to see a serious conversation be had with more attorneys and legal representatives that can maybe actually help us start doing something, but it has to be organized. No more just us talking and rallying. Y'all, we got to have some solutions come up too, okay? Right. So that's my point.
Chantel, I'll ask you that question. Should we have a Black women's healthcare Bill of Rights? And I apologize to Black Women Voices, the group. I'm going to take that as do we just have a Black women's Bill of Rights? Forget healthcare, right?
That's an amazing thing to think about, though. When you think of, and I'm thinking about it from a historical context that we can even ask that question in this day and age, right? And I think one of the things that I'll mention is I would absolutely support that. It's like you said, as long as it's organized. But I would even support it more if our youth are at that table, because we know the CDC has released data that African Americans, Black youth are experiencing health conditions and chronic conditions way earlier than anybody. In your 20s, as Dr. Carr mentioned, 16 years old and somebody was perfectly willing with putting you on a medication that you could have possibly had to carry for the rest of your life. And we are in a time, and I'm the millennial, kind of thing, but we're in a time where kids are so, and not different than any other generation, but fearless. They literally are willing to lay down for what they believe in. But the data on that, we could lose them to police brutality, but we could lose them to high blood pressure, diabetes, and everything else in between. So I appreciated that when I saw that in the comments when somebody was talking about youth. We asked the question about, is public health, is health politics? Get youth in that conversation and see they are literally the next generation that's going to lead us into what we are, hoping for with, like I said, questions about a bill of rights for Black women and their health. I think that would be an amazing situation to put our kids in to see how they can lead us into something better. So I think that's absolutely brilliant as long as they are at the table in a meaningful way where they can have a voice. And I think the other part of that, as you mentioned, we have people around us who want to be in conversations. But I think one of my biggest pet peeves is when people say we need to have those hard conversations. Ain't nothing hard about it because I walk the walk every day. Mm-hmm. So why is it so hard to you? Why is it so hard to you to sit at the table and listen? So I think those are the things that we have to stop placating when we think about things like a Bill of Rights. Stop saying things are hard. It's not hard for them just to show up. And if they don't want to show up, we don't need them there. But the people who are in this group, these panelists, the people who are creating these spaces, those are the people that we sit down at a table and say, what do we need? Is it the Bill of Rights? Absolutely. Is it making sure that we have political organizations that can get more Black people in these rooms and in leadership positions? Absolutely. Is it us pooling money together to make sure that we can always have money for Black practitioners to go to school and get whatever they need? Absolutely. It goes beyond the Bill of Rights to me. It's us sitting down and making sustainability plans so that we don't constantly have to deal with someone putting grants in our community and telling us how it's going to work, those things. So yes, a Bill of Rights is great, but what goes beyond that piece of paper? That's what we've had for years, pieces of paper that people put on bookshelves.
Right. No.
Sorry.
Yeah, Dr. Tabatha, go ahead.
Mm-hmm. Real quick, and it's a different topic.
Can I bounce back on what she was going to say?
Yeah, so go ahead.
So Chantel, I was just going to let you know. So when I was in high school, Representative Opio Ture actually, along with the Oklahoma City Youth Council, educated our group, and we used to go lobby at the Capitol on that tobacco bill.
Yep, SWAT.
And that's how I learned how everything worked. That's what I learned what a lot.
Me too.
It brought us to that table and listened to us as youth. And so I completely agree. The reason why I even understand a lot of what's going on is because somebody gave me as a youth at the table, and they actually helped listen to what we had to say. So I completely agree, especially as a pediatrician, about when you motivate that younger generation, they are fearless and they're going to go hard.
All the time. And they won't take excuses about what a hard conversation or, whatever it may be. The excuses of it all. So thank you. I'm glad this is a great thing.
Yeah, and any reference to my father-in-law, I'm going to take that on for sure. So thank you for bringing him up. But Dr. Tabatha, I definitely want to make sure, I know I don't know if it was a different question or along the lines.
It all goes together. It was about maternal mortality rate. We brought it up so much, but I want to make sure the audience knows that this isn't just a Black woman problem. This is all women collective problem. Yes. When you look at our numbers, in the US, we have a higher mortality rate than Germany. We have a higher maternal mortality rate than the UK. It's higher than the Netherlands. It's higher than Japan. And it's like, why? Why is our mortality rate that much higher? But there are some states that are closing the gap. North Carolina has managed to do it. California's done it. Now, they didn't pass a Bill of Rights, but they have something called a toolkit, is what I think it's called, a toolkit that helps with the top 3 reasons why we have this maternal mortality rate. So I just wanted to make sure the audience knows that this is a woman problem that we're dealing with, and it shouldn't happen, because I think the number is like 60% or so, 60-70% of these deaths are preventable.
Yes. And we lose about 700 something women a year in dealing with maternal mortality. It's just that Black women are 3 to 4 times more likely to be one of those, maternal mortalities. And yes, 60%, can be prevented. And that's a lot. Mm-hmm. That's very, very significant, you know, in relation to, and I love everything that everybody's saying regarding the Bill of Rights, like you said, as long as it's organized and structured accordingly. And I think it's very important for us not to be about diversity. It's okay to sit at the table, but if we don't have inclusivity to talk at the table, it really doesn't matter. Right. To be honest, I mean, we need to have a voice, you know, just like what we're doing today, you know, as far as being as that's concerned. And that's even talking about, for example, what's going on here in 2020 in dealing with, you know, with our protest. Well, what do we do next? Mm-hmm. You know what I'm saying? What do we do next? Yeah. Mm-hmm. And so it's really an ongoing thing. You know, we need definitely inclusivity on boards and panels, you know, and all things, you know, that would be as far as us, you know, being successful, you know, in moving forward. And to be honest, I definitely believe it's my duty too, as a licensed clinician, to make sure that I pass on to you and to others as far as being empowered and understand that your voice does matter, as far as, you know, us doing what we need to do to reach the goals and outcomes. And, you know, with me working with women, you know, in maternal and child health, they all want to come out being healthy. We don't want maternal mortality. We don't want, you know, infant mortality. It's really about being able to empowering them and to make sure they understand the things so they can come out successful and walk out of a hospital with their baby.
Mm-hmm. Yeah.
I think and I'm sorry, I know it's time, but I think one of the things, and one of my favorite people, Ms. Lampkins, mentioned this, but I think one of the things we also have to be very conscious of is protecting our peace and protecting our peace. So, and she mentioned how I was going to mention funding pimping. So you're going to have a lot of people that's coming into our communities with this savior syndrome of, I got a grant this and a grant that, and we're going to help you do this. And one of my pet peeves, I always say, what's your sustainability plan for when the funding runs low, it disappears, and you just leave them high and dry? So be very conscious of what, if people are coming, don't let them pimp that word partnership and community engagement. And if they don't see you as an expert in your experience and they don't value your experience, there's not much they can do for you, because they have their own prescribed ideals of what your experience should do for them, because that sounds good in the narrative. It sounds good when they have to report those outcomes. But if you have people who are coming into your community who can't move beyond data, and they can't see your experience as the data that you live day to day, then just be conscious of who you're willing to sign those pieces of paper with. Is there a shared ownership? And the question that I tell people to ask all the time, if someone comes to you with these opportunities, always ask them, is it yours, mine, or ours? And if it's never going to be an ours or a mine, then what you have to offer doesn't benefit me much. Because once you leave me high and dry in these communities, because of course it's great, you put all of these things into place, but if the community can't afford to sustain it, they aren't a part of the reporting or their own, storytelling, or when you put them in front of a camera or for a quick little cute picture that you can tell a success story about, that is literally exploitation.
Right.
So you cannot literally you are exploiting the narrative. You are tokenizing people.
Yes.
So they say hard conversations. I say you ask them harder questions. What's your intent? Did you ever ask anybody in the community? I mean, you want me to have a park. I can't send my kids to the park because I'm scared of getting whatever, or their needle, whatever the case may be. You're doing it for you. So is it yours, mine, or ours? Protect us and protect our peace. At the end of the day, you are more than a data point.
No, thank you. No, I think that's such a great, and we're running out of time, right? Like there's never enough time for this important conversation. So before I get to kind of closing remarks from each from each panelist, I definitely want to have one last question. And the reality is, Black women tend to be the person who is reminding people to take their medicine, to go see the doctor, to get this checked, to do that. But we may not be doing that enough for ourselves, right? So if you all, in your expertise, and Dr. Tabatha, I'll start with you. Could you tell us one healthcare tip you have for Black women? I'm going to give you all 1 minute to answer that just for time reasons.
Oh, 1 minute. I better.
I know. I'm sorry.
Know your numbers. Not just know your numbers. I need you to understand your numbers. You know, when women come to me and they say, hey, you know, my doctor just told me I was pre-diabetic, right? So my doctor just told me I'm pre-diabetic, or my blood pressure is high. You know, what can I do? And when I ask them, okay, what is your blood pressure? Well, I don't know. Well, what is your blood sugar? What is that A1C? What is that fasting glucose? Well, I don't know. I need us to know our numbers. I need us to understand our numbers, because when it comes to metabolic syndrome, and that just causes a whole plethora of challenges in our body. You know, we're looking at your waist size. You know, I might be, you know, really stepping on some toes here, but, you know, as a female, that waist size should be 35 or below. As a male, it should be 40 or below. That triglyceride number, that cholesterol number, you know, that blood sugar number, that blood pressure number. Know your numbers, and there's no one that knows your body better than you. So you have to take 100% responsibility for your own health, and don't just tell me I'm just going to go back to the doctor in 6 months and let them check it.
Thank you. Basheera, yeah, if you don't mind, what's one healthcare tip you have for Black women?
My number one health tip is the same name as the first book I ever wrote, and it's called Love Yourself Enough to Be Healthy. And what I mean by that is, it sounds simple, but it's one of the most difficult things, especially for women of color. And I mean for our Black sisters, even our African sisters, because we are the caregivers, because we are the leaders of the families, the communities, the nations. Hell, let's go ahead and say it, the world, because we will be running this world. Everything is put on our shoulders and we put ourselves last. But if you think about it, if we don't take care of us, what do we do when it all falls apart? So if you can't find something to make you care enough about yourself, to know your numbers, to understand your power, to understand how to talk to your family and ask for help, if you can't find one thing that you love enough about yourself, that takes a deeper conversation, and you need to go ahead and talk to your community of loved ones and get that started, because something's not clicking here if you can't find enough love in here. And that also takes all the rest of us sisters recognizing when our other sister doesn't love herself enough. And stop saying it's cute. It's not cute.
That's it.
It's not. It's not about physicality. That's not what I'm saying. Don't love her when she's unhealthy and then hold her hand when she's dying in a hospital, but you wouldn't do something about it before. So I'm in on that real tip.
Yeah.
Okay. I'm gonna go back to loving Basheera, but
no, thank you.
Enough to do that. Y'all are just really passionate. I love my people. I love my sisters, and I don't want us to be the crutches that help us destroy each other. Because that way.
That's real talk. Chantel, yeah, what's one healthcare tip?
Talk about health in a real way. It's not just talking about how grandma has sugar, or talk about it in a in a way that you feel comfortable. Of course, don't disclose anything that you don't feel comfortable talking about. But I mean, even down to simple things like why I'm going to go get so and so checked because I felt this way, so that you can alert people around you to how you feel. And why we're really making these changes. And I know in our community, we make those little nuances, sugar, blood pressure, whatever. But talk about it in a real way. Because again, like I said, our kids are watching. So if they can, verbalize and communicate what they're feeling, how they need to take care of themselves, and go communicate it to a doctor, I think that's the best thing we can do, other than writing down your family medical history. So I know that was one.
That's a good one right there. Maggie, yeah, healthcare tip for Black women.
You are your biggest advocate for your physical and mental well-being. You are your biggest advocate for your physical and mental well-being. You know when you are down and out, my sister. You know when you're physically unwell. I'm going to need you to get to a counselor or a physician. Also, too, in bouncing off of that, utilize support systems. Ask for help. Ask for help. I understand everybody doesn't have help all the time. I'm well aware for that. but you have good friends or as me, good sorority sisters that you definitely can lean on for help. I believe in support systems. I really, really do, because we as African American women are resilient.
Woo.
That's my 2 cents.
And then Dr. Jihan, yeah.
Great tips and comments. I think I will end with, do not give up.
Mm-hmm.
Never give up on yourself. Don't give up on your children, your families, etc. I find so often people are like, well, we can't eat right. It's too late. It's never too late. My grandmother just passed away at the age of 100. I watched her make so many changes within her life in terms of her health, wellness, physical activity, even in around 90 years old, she would walk around Walmart to make sure that she kept up with her health. And my grandfather's 98, and he always tells me the same things. Oh, well, this happened. Well, I better do this. That mentality that they have, they never gave up. They went through the Great Depression, all these other things. We may be experiencing that we think so horrible. History repeats itself, right? But our ancestors never gave up. They always saw a light at the end. And I encourage us to remember that, as everyone said, getting help, asking for support, taking it serious, loving yourself, etc., in educating yourself, but making sure that you remember that you can always make a change. And so I just recommend that we always remember that, and that we don't forget it. Because if we keep that in our minds, then when you're down and out, you'll say, but you know what? I can fix this.
No, so profound. And more importantly, because this is what I do, like I'm writing all this down for me. So I took this panel for my health and what I needed. So I hope the viewers did too. Before we end, those were all of our questions. But before we end, I definitely wanted the panelists to have just take a 1 minute, few seconds to give some closing remarks. And I hope if whatever you feel comfortable with, share how people can get in contact with you, because what we see from the live comments is that people have specific questions, and our sisters need help from getting motivated to asking questions about other Black providers. So if you have a Twitter or social media handle, if you feel comfortable, I'd love for you to share that as well. So I'm going to start with Chantel, if that's okay with you.
Yeah. That's fine. That's fine. Just as a wrap up, I think understand that you just being here today and watching this is a major step in you being the advocate that everyone on this panel just talked about. It's going to help when election seasons happen and you learn how to share that information with your community, how to ask elected officials harder questions, tougher questions. Make them go beyond the talking points that they've heard. Right. I'm taking some self-accountability in this too. And the reason why I say talk about health in a meaningful way is because, as the ladies mentioned, you never know who's gone through what you've gone through. You never know who knows that Black female physician. Literally when I moved to Oklahoma 5 years ago, I depended on my sorority sisters to say, hey, not just where I get my hair done, but who's a good OB, GYN, who's a optometrist, all these things. So I think we understand our village. We understand who we are. We understand our culture. Don't let anyone diet down for anything. And if nothing else, protect each other. So if you have any other questions for me or just more information, feel free to reach out to me by email. It's chanteljhartman@gmail. And my Instagram, because I don't have a Twitter. And you can find me on Facebook with my name, but my Instagram is Chantel_MCMV. So Chantel_1908 in Roman numerals.
Thank you, Chantel. Maggie, yeah, go ahead.
Okay. Definitely thank you for everybody that tuned in today. For your mental wellness, please feel free to contact me, especially dealing with maternal and child health. Things associated perinatal mood and anxiety disorders, postpartum depression, postpartum anxiety, PTSD, OCD, things of that nature. Even if you want to get a mental health therapist, I definitely will get you to one accordingly. So I can be reached at MaggieG405@gmail.com. Also on Facebook, I can be reached at Maggie Green 2 with 2 capital I's at the end of Maggie Green, 2 capital I's. That just reach out. Please don't hesitate to reach out if you need anything in associated to mental health.
And then Dr. Jihan?
Yes, this has been a very excellent panel. I really appreciate everyone coming in, and I know I would just add it to the mix, but hopefully something that I said was beneficial. Just reminding people, obviously I take care of people from birth on, and so just remembering that life is a cycle, and we want to make sure that we are promoting healthy cycles from this point forward. I say 2020 as our vision. I failed to mention this before. I just wanted to mention it. I am helping to open up a free health clinic. It'll be the Clara Community Health Center on the east side. We hope to open around August 9th. I'm just putting a plug out there because this is an opportunity. We would love for people to come in and help. We would love for people to come in and teach classes. We would love for people to do health literacy, education, fitness, et cetera. We have a small space, but we will do whatever we can to open those opportunities. I'm just one of the people assisting. I see my other board member, Senator Anastasia Pittman, commenting as well. So I just want to share that because the way we make changes is to create our own spaces sometimes and to actually do some of those advocacy. In terms of contacting me, I actually just launched the page. It's Dr. Jihan. I don't give a ton of free advice, right? Because I got to pay my bills.
Exactly.
Through the clinic and through other things. I often give a lot of information, but I typically don't give out my email because if I'm not your medical provider, then anything that I say or tell you to do can be held against me. And so I prefer that if you've signed a document or something, if I'm giving out that advice. But however, if it's something very general, you can follow my Facebook page. It's Dr. Jihan, Jihan. I haven't actually put much on it. I literally just created it not long ago just to separate myself because my business, I have other employees and other providers. And so I wanted to make sure that if people just wanted to ask me questions, but I'm at Peace of Mind Pediatrics. If you really want to see me and get in, I'm full, but if people say they want to directly see me, I don't mind. I definitely am open to taking new patients as always, because people, rotate and move. And so that is something available to you as well. So thank you very much for having me.
Thank you. And Basheera?
Yes, well, I want to piggyback on that and just say thank you, Black Women Voices, for inviting me into this space. Thank you, amazing Black sisters, for sharing with this time. And also thank you, viewers. My main tip in rolling this kind of up, you all, well, not really tip, just something to kind of remember by is, you all don't allow any circumstance, don't allow any person, don't allow any institution, don't allow anything in life to keep you from your destiny. All right. I'm not going to get spiritual religious on you, but you are not from this life. You were not created by anybody who's out here right here, who seems like they're controlling you. You have to understand that there's an inherent power in you to overcome anything. And it is hard. That's why we're gathering our communities and our villages once again and making sure you have the support that you need. So much similarly to what many of the ladies said, definitely don't give up. But at the same time, rely on you too, because there is a certain gift in there that no circumstance can take away. You all can reach me at BasheeraAhmad.com. That's BasheeraAhmad.com. And you can leave me a message on the contact page. And any of my social media, I got all of them.
Thank you.
Thank you so much.
Yeah, Dr. Tabatha.
Yes, thank you again to Black Women Voices. There's one thing that I want to leave you with, and that is wellness is body, mind, and spirit. We talk a lot about the body, we talk about the mind, but you really need to nurture your spirit too, and what that really looks like for you. And of course, don't forget to practice self-care. With all the many things that we have on a daily basis and all the multiple hats that we wear on a daily basis, your body is the only thing you have that's going to keep you going. And if you don't nourish your body, take care of yourself, take that self-care opportunity, whatever that looks like for you, then you're gonna be stressed, you're gonna be overworked, you're gonna be overwhelmed. I see a lot of women who are at that exhaustion stage, and there are 3 levels of stress, and we really need to avoid being in the exhaustion stage, because that's where our problems start. As far as reaching me, Instagram, Good Girl Chocolate. Good Girl Chocolate is a plant-based chocolate that supports all healthy lifestyles. So if you're vegan, gluten-free, soy-free, dairy-free, keto, Whole30, Good Girl Chocolate is my Instagram handle. And then I have at Dr. Tabatha Carr as well. As far as emails, you can reach me at info@goodgirlchocolate.com or info@livingandlovinglife.org. Livingandlovinglife.org has a lot of resources for women in natural health. So check me out if you have any questions.
Yeah. And then lastly, I just want to thank this amazing panelist, this amazing group of Black women who are bosses in their own right. Thank you for sharing your experience and your time with us. We also want to thank our sponsors again, Blue Cross Blue Shields of Oklahoma, who was our title sponsor, the Gooden Group, and then Bumpers Shoot PR. And most importantly, thank you to the viewers. For many that may or may not know, this came organically. Black Women Voices came organically when Governor Stitt held a conference on race and left Black women out. Probably no surprise to Black women in that sense, but we Black women came together. Black women came together to create a safe space for Black women. So I'm really excited to announce that the next Black Women Voices will be on August 12th. So August 12th, so like Black Women Voices on Facebook and all other social media, like their page to get more information. And the next topic is going to be about legacy. And legacy really means about women who have paved the way for other women. And I think that's so important.
Absolutely.
Lastly, and also important, is please donate to Black Women's Voices. You can go to www.okwc.org /donate. And please donate, right? Because one thing that we also believe in is that we pay the coins to Black women always. So, and the last thing I want to say for my last remarks is just that I am a firm believer, and it is apparent from this panel as well, that we are much believers of just the idea of no decision about us without us. And that is something that I just leave everyone that is here watching, is to make sure to be at the table. If you're not at the table, make your own table. So my very last thing I want to say is, just because I close out most things with my favorite quote from Sister Alice Walker, the author of The Color Purple. Definitely want to end with activism is my rent to live on this planet. And I firmly believe that. So with that said, I want you all to get involved in any way possible, what feels comfortable to you. I'm encouraging the viewers to make sure to get registered to vote. I know we had a big election last week, but we have another one coming up in November. And one of the biggest calls to action that I can do right now is to fill out the census. I know that is tough for some people to understand how to do that, but filling out the census is one of the biggest healthcare decisions you can make, because that money assures that it comes back to the states. By counting each person that's counted, the money is going to come back to the state on the local level. So with that said, thank you all so much for joining us. And thank you to the viewers, and we will see you next month.
Okay, thank you.